When you consider that over 4.2 billion, that's with a B, prescriptions are written every year in the United States, it's not hard to imagine that some of these drugs are going to cause some sexual health side effects, along with all the other side effects that people experience and that healthcare providers worry about. The point of this module is to bring to light some of the common medications that could be contributing to sexual dysfunction and problems with erections. So I'm not going to dive into the mechanism of all these, but just to bring it to light and to allow you to understand that there may be some things that you're taking that are causing some issues, and certainly something to discuss with your regular doctor about options and alternatives. So first and foremost are antidepressants, particularly SSRI, which are like Zoloft and Celexa. Those are the serotonin reuptake inhibitors, and anti-anxiety medications. In the men's health course, we talk about benzodiazepine use, and also in the sleep course, how that has been clearly linked to dementia. But this category of medications is notorious for causing sexual side effects, decreased libido, potential for hormone disruption, and a variety of other things. So you want to talk to your doctor about maybe some options or similar medications that have less sexual side effects. High blood pressure medications, there are a variety of classes of high blood pressure medications. Notorious is the beta blockers, which cause fatigue, but also can cause some erection issues. We know that diabetics who use a medication called losartan, which blocks angiotensin, they actually have improved blood flow and less issues with erectile dysfunction. So if you have high blood pressure and are experiencing some sexual dysfunction, talk to your doctor. There may be an alternative for you. Diuretics, these are used for not only high blood pressure, but also for fluid retention. So puffy, swollen ankles, heart failure, fluid overload, things like that. This class of medications also can negatively impact erectile function. Seizure medications. Obviously, seizures are a very dangerous health problem that needs to be managed properly and appropriately, and working closely with your health provider or neurologist in regards to a medication that has the least potential to disrupt your sex life, certainly a worthwhile conversation. Antihistamines, cold medicines like Benadryl, things like that, also can have a negative impact on sexual health. NSAIDs, which are non-steroidal, and this sort of ties into the comments I made in a previous talk about chronic kidney problems, but non-steroidals have a effect on the way blood flows through the kidneys, and also have some effects on the vascular system and can contribute to sexual dysfunction. Parkinson's medications, these are very powerful medications that act on the central nervous system, the brain, and can have a variety of side effects, including erectile dysfunction and fatigue, decreased libido, and a variety of other negative sexual features. Arrhythmia is just basically an abnormality of the heart rhythm. It can be caused by a variety of things. The medications used to control those are very potent and powerful. This is a difficult one, depending on what the dysrhythm is. There are certain dysrhythmias that are dangerous, and the medication options are few and far between. An option would be to see an electrophysiologist if that applies to you. This is a physician who specializes in finding the problem and treating it with electricity, which may remove or at least decrease the need for some of these medications, something that would have to be done in coordination with a cardiologist and likely your family doctor. H2 blockers, these are also antihistamines, but more in turn of acid problems and acid reflux. These can also have a variety of problems on sexual function and also have some long-term negative impacts on bone health and the gut biome, the healthy bacteria in your system. Muscle relaxers, obviously side effects of these are sedation and fatigue. That's not going to improve anybody's sexual performance without a doubt, and certainly consider some other options if this applies to you. Prostate cancer medications, depending on the type of cancer and the staging of it, sometimes hormonal therapy is used for prostate cancer treatment, and this blocks some of the effects of the androgens, which can lead to flushing and impotence. That sort of wraps up some of the drugs that can cause erectile dysfunction. I just thought it would be important for you to know the variety of categories, including some of the over-the-counter things that I mentioned, like Benadryl and H2 blockers like Pepcid, and things like non-steroidals, naproxen, ibuprofen, Aleve, things like that you may be taking with very little thought that it could be having a negative impact on your sex life.